So, Partnering Doctrine, I'm going to welcome Brian Garcia to the stage, who's the Chief Product and Technology Officer at Welltok. Talk about something that is, I know, of top of mind of a lot of CEOs, and I'm sure beyond that, but dealing with whether or not to build it themselves or to partner or to acquire, all of those different things. So, round of applause for him. Welcome to the stage.
See how well these slides work. Good afternoon. So again, I'm Brian Garcia. I'll give you a little bridge history. I've got about 10 minutes with you today, so it's going to be a pretty quick chat. So my history is I worked on a health plan, Aetna, for about 12 years, as well as a division of Aetna called Healthagen, which was focused on provider solutions and ACOs before I joined Welltok. So I've had a few different roles working inside of a large payer, working on the side of the provider space and ACOs, and now on the consumer side, all in healthcare. And I've been part of this conversation all through my career of do we build, do we buy, do we partner, do we build, do we buy, do we partner? Early on in my career, I was part of the IT team, and just like all IT teams, we could build anything. It was just technology, it was just software. So all we had to do was get the right people in the right room, and we could build as much software as we wanted to solve any problem. So we tried a lot and we failed a lot. We succeeded from time to time. But this fundamental question became more and more interesting to me as my career progressed and as I got more and more involved in industry. It became really interesting to understand why. Like what actually goes into this equation? Why do you choose to build? Why do we choose to partner? Why do we choose to buy another organization? What's the rationale behind that? And I found some interesting insights in that, mostly because of the failures that occur, that the lack of expertise in the side of an organization. It's not lack of expertise from a technological perspective, it's lack of expertise within the domain in which we're working. And if we're working in a domain that we haven't done before, that an organization hasn't entered into, and it's a new endeavor, that domain expertise, that intellectual property just doesn't exist. So yes, the technology is easy, but understanding the domain is very hard. Understanding how to engage with a consumer. The greatest thing in healthcare is being able to interact with the consumer, but find someone that can actually articulate exactly what that means. Because exactly what that means is exactly what's going to get built, and it becomes extremely problematic. So I thought more and more about it, and more about it. Then I started understanding there's this fundamental flaw and a fundamental principle inside many organizations that isn't looked at, that there is a fortress of preservation that is substantially stronger than the tribes of change. That's what's trying to be done inside of these organizations. There's these small teams that want to do something different. They're extraordinarily passionate. They may not even came from healthcare, and they want to do things differently. But there's this giant fortress that they're up against. And it's not that that fortress is bad. It's stable. It drives revenue. It drives earnings. It makes shareholders very happy. It's not a bad thing. It's a thing that just needs to be respected. And early on, I didn't respect that. And I don't think a lot of companies respected that. That it wasn't the technology that was the challenge. It was the environment in which that technology needed to grow. That was the challenge. Just like this clicker. So, innovation. Read any PowerPoint from any company on earth, it will have the word innovation in it in some way, shape, or form. So let's define what that is. Innovation requires experimentation by its very nature. Innovation is something a company has never done before. If it's a payer, it's not building another claim system. Not terribly innovative. It may be, how do we actually interact with consumers outside of their plan of benefits and their claims that we're trying to pay? I have no idea. Well, we need to innovate on that then, don't we? Well, how do we innovate? We need to experiment. Well, what's the fundamental aspect of experimentation? Failure. Without that, there is no learning. So that IP that we talked about, that IP, that understanding of that domain, without that constant recursion of experimentation, finding out what works. Maybe you got lucky and it worked right. Maybe you got unlucky and it didn't work at all, but the organization learned. So building that learning cycle inside of organizations is highly critical. But that learning cycle is against the fortress. Because you're trying to do something different, something outside of the four walls of the castle. And the castle's a good thing. But that's a risk. How far outside am I going to allow that team to go? How bad is failure? How far will I let them go off the reservation? They've gone too far, bring it back, bring it back, bring it back. That's not good. So how do you create this loop inside that organization? How do you try something new? So the second fundamental thing that I learned to understand and deeply respect is this loop can be implemented in lots of different ways. But to implement this loop, the focus on the problem that we're trying to solve is much more than how we solve the problem. So a lot of builds end up being IT projects. And IT projects have status reports. And the status reports become, well, how is that project going? And what happens in how is that project going is, what problem are we solving? Because we start missing dates, and we get over budget, and the scope within the project starts shrinking. And we have to shift people off the team. And we keep getting further and further away from why did we start this in the first place? What problem were we actually trying to solve for? So, I came down to a conclusion that partnerships, which has been a pretty big theme today, become a really powerful weapon inside the quiver of the fortress. They're not IT projects. The relationships that can be created with another organization, we can learn from that other organization what they have learned in their failures. So we've solved that problem. We can learn from another organization and how we can actually solve the problem. We can learn from somebody else on are we actually solving a problem or are we solving a symptom? Are we implementing the same type of thing in a different way that solves a problem that we had 20 years ago, as opposed to implementing something that solves a problem that we have today and will sustainably solve it tomorrow? So partnerships became really interesting to me. But partnerships have their own flaws. So who's the right partner? And they often are colored by technology. So who's got the best technology? Who's got the best mobile app? Who has the sexiest user interface? All important things, but not the most important thing. Who has the best results? Who actually solves the problem that I want to solve for? And who has a culture that I can work with? And that last piece is critically important. I want to work with a company that wants to work with me, that just doesn't want to sell me. They actually want to work with me. I want to work with them. I want to share information with them, and they want to share it back with me, so I can create that learning loop that I couldn't create because of that fortress. That cultural aspect is as important if we go out and buy somebody as much as it is if we go out and partner with somebody that you may end up buying at some point in the future. That cultural aspect is more important than the technology. Because if it's not there, the technology will wither and die. How fast have you seen technology move in healthcare in the last few years? How fast have you seen it implemented in these large fortress organizations? There's quite a scale to those two things. Technology is moving very fast in an organization in an industry that moves pretty slow. Being able to leverage both ends of that spectrum become a very, very powerful opportunity for both those that have incredible technology, many of you in this room, and those that have incredible market share and incredible influence inside of the healthcare system. Millions and millions and millions of captive lives just waiting to be impacted in a different way. Bringing those two things together, marrying technology, and being able to open the doors of the fortress and let those tribes of change in a protected way that the organization can learn from, can be a really powerful way to go about innovating in an organization. So I wish you all the very best of luck to find the Bert for your Ernie. Thank you.